All right, I'm going to start the procedure now. You might feel a little pinch.
Okay. Okay. That was more than a pinch.
Okay.
Woo.
You got.
Have you ever been told that having an IUD inserted will feel just like a little pinch? Yeah? No. As an OBGYN, I wish that we would stop minimising how this feels, and generally we need to stop minimising women's experience of pain throughout their lives. Yes, it's true. Some people will barely feel a thing, especially if they've had a vaginal birth before. But for many others, having a coil inserted can be sharp, it can feel crampy or even painful. Here is what is actually happening. So we start by placing a speculum to get a good look at your cervix. So we open it up and we can find the cervix, and then we can place an IUD, which is held in a plastic tube. We place it through the cervix directly into the uterus. But your cervix and your uterus don't always just quietly cooperate. Your uterus can often contract in response to the stimulation, meaning it cramps and you feel those kind of almost contraction-like pains. You might also have a narrow canal in your cervix, which means there's some resistance as we're trying to push that IUD in, so it stops it from going in smoothly. And yet, many women are not offered anything to help. No anaesthetic, no pain relief, just told, breathe through it or don't worry, it'll be over in a second. A 2019 randomized control trial investigated pain management during IUD insertion, and the study found that when we give a local anaesthetic like lidocaine, it can significantly reduce pain scores compared to a placebo. And this shows that the procedure does actually cause some notable discomfort. The discomfort you get when you have an IUD inserted isn't just from the device itself. We also sometimes use tools like a tenaculum, which is used to stabilize the cervix, or the uterine sound, which is used to measure the uterus. They can also contribute to the pain. Also, people can have anxiety because you've had previous negative experiences, and your own individual anatomy can all influence how much pain you feel. So whilst not everyone needs pain relief for IUD insertion, as healthcare providers, we should discuss pain management options as a bare minimum. Here are some things that can help you. So you can take Ibuprofen about an hour before you go in. In some clinics, you can ask them to use a local anaesthetic gel, or even sometimes we need to give an injection of a local anaesthetic. For some people, distraction helps. So popping your headphones in, listening to some music or a podcast, or just having a friend behind the curtain that you can talk to. Also, you can have it done under sedation, particularly if you've had a previous traumatic experience, you have vaginismus, or you do just experience severe pain with speculums. So pain during an IUD insertion is real. It varies from person to person, but being informed and being able to discuss your pain management strategies with your provider can make that experience more comfortable. So let me know your experience.